If you're not sure how to put eye drops in your child's eye and you really need to, I'm gonna help show you with some quick tips. Keep watching. Hi everyone, I am Dr. Rupa Wong, board certified pediatric ophthalmologist, and on this channel we talk about kids' eyes, eye health, eye makeup health, and eye surgery. If any of that interests you, hit the like and subscribe so you can follow along on this journey. All right, this is a video that was requested a bunch by the parents of my patients because oftentimes I recommend eye drops for them, whether it's an artificial tear because their kids' eyes are dry, or it's an antibiotic drop because they have a bacterial conjunctivitis, also known as pink eye, or because I've done eye surgery on their child and we need to get these drops to prevent infection and inflammation. Whatever the reason is, sometimes eye drops can be really traumatizing for children, especially because likely we've traumatized them in the office with the dilating drops because those things sting. All of them. I mean, I'm always honest with children when they come into the office. If they ask me if they sting, I do tell them it stings for 15 seconds and then it's going to go numb. But that might have traumatized them, especially if you have a child with special needs. They might not like things near their face. They might not like to be touched. So I wanted to go over just a few couple tips to help you put those drops in kids. Now, my kids are older, so I'm going to use my daughter, Aria, as an example. She's 8. She's not scared of eye drops, but I just want to at least show you what it's like for a child who possibly could be scared. First thing I always see as a mistake that parents make is that they try to open both the top and the bottom, and they think that they have to pry the eye open and that they have to drop the drop directly right on top of the middle part of the eye. And that's not the case at all. There's a lot of different ways to get that medication into the eye where you are not traumatizing your child like that. So the super simple thing is, first, put your child down in terms of either lay them with their head in your lap, on the floor, or on the bed. It's going to be the easiest way to stabilize. Now, if your child is younger, you can use your legs to crisscross over them if you're doing this solo. But if you have a really young toddler, I'd recommend making this a 2-partner parent situation. If you can grab a helper, that's really going to be of big assistance, because it is hard sometimes to fight a 2-year-old and put these drops in, even if you've got them wrangled into the position. But this should help. You don't need to pry the top and the bottom lids open. All you need to do is create a pouch with the bottom lid. You can just pinch it open, and that little pink pouch, if you put the drops there, that is going to be more than enough to get the effect of the drop in the eye. It doesn't need to be directly on the eyeball, because when the child blinks, they're going to blink and that medication is going to distribute onto the surface of the eye. The other way is you might have a child who just absolutely refuses to open their eyes. And believe me, I have seen some kids close their eyes, like clench them shut. And when I try to open it, just flips the eyelid up. You can put the drop on that top eyelid if that were to happen. Or you can actually even put the drop with the eyes closed, create a little pool of the medicine in the inner corner. Now, if you're doing all of these techniques, first you do want to make sure you wash your hands thoroughly before you touch anything. Gather all the supplies that you might need beforehand. So make sure you've got the correct drop, if you need a tissue. But if you're doing the technique where you're pulling it into the inner corner of the eye, don't let your child wipe their eyes right away, because they're going to just wipe away the medicine. So you are going to have to stabilize their hands so they don't do that. You can just pile the drops there and then just kind of hold their hands. I tell them to clasp their hands together. The other thing is, sometimes children just like control. I know my kids do. So oftentimes, if you involve them in the process and ask them to lower their eyelid for you, that can reduce a lot of the anxiety and stress associated with eye drops, and they can just be a partner. You don't need to wrangle them down, you don't need to hold them down. Might be a little bit easier. Definitely make sure you talk through the drops with your child. Don't reassure them that it might not sting if it is actually going to sting. But to be honest, most of the antibiotic drops and the drops that we prescribe for children don't actually sting. They just feel wet. And once kids get through that first couple of times, they realize it doesn't sting and it gets a lot easier. The second thing is, if you're truly having difficulty putting the drops in, All of these usually are also available in ointment form, and for some parents they find the ointment form a lot easier. And the same, you can just lower that bottom lid and squirt a little bit of that ointment underneath to that bottom, and then it's going to distribute when the child blinks. So if you feel like ointment's just easier to get in because it stays and the kids can't rub their eyes quite as much, or it's not going to fall out of their eyes, then talk to your ophthalmologist or your optometrist and see if there's an ointment version of whatever medicine that they have prescribed. All right, I hope those little tips were helpful and decreases some of the stress and anxiety of putting drops in your children's eyes. If you found a technique that works for you, I'd love to hear it. Drop it in the comments below. And if you have any other thoughts for topics that I should be posting in my videos, I'd love to hear those as well. Until next time, I'm Dr. Rupa. It's good to see you. Bye-bye.